Because the annual election period is coming up October 15th through December 7th, and while the program covers many health concerns in retirement, still leaves a lot of holes in what it doesn't cover. And that is where Medicare supplementary plans or Medigap and Medicare Advantage plans come in. But trying to decide between them doesn't sound like an easy decision. So, Scott, how do you guys help clear up the confusion and help pick the right plan for clients?
Well, Chris, as you know, and I've been doing this a long time. I celebrated 30 years actually a couple of weeks ago, and everybody that we talk to, they say this is so overwhelming, so confusing. How do we decide? So I'm going to break it down here real quick and go through some things that first what the original Medicare covers. Original Medicare has parts. It's Part A for hospitalization and Part B for medical services. And it's just that. I mean, that's all the coverage you get for original Medicare. I do have some clients, quite frankly, I don't know why they do this, but I do have some clients that have signed up for just original Medicare. They haven't picked up anything else, the Medigap or the Advantage plans. They just have original Medicare. And what they're getting with original Medicare is they're getting hospitalization coverage with some major gaps in the coverage. For example, the first 60 days of a original Medicare hospital stay for 2024, you're going to have $1,632 out of your pocket, and it escalates from there. Skilled nursing is covered by Medicare for the first 20 days only. And days 21 through 100 is all covered at $203 a day. This is for 2024 numbers. And then your Medicare Part B. Medicare Part B has a premium. If you sign up for Part B, you're going to have a premium deducted from your Social Security if you're on it. And you're going to have a $240 deductible. That is an annual deductible. After that deductible, original Medicare is 80/20. So you're responsible for 20% and the Medicare picks up 80. So as you can see, there's some major gaps in that coverage. So what we do is, we make those ugly numbers go away by signing you up for either a Medigap plan, also known as a Medicare supplemental plan. On a Medigap plan, Part A hospitalization is typically covered at 100%, so you'll have nothing out of your pocket for a Medicare supplement or Medigap plan. And the most common plan that a lot of people are looking at is Plan G as in George. That plan will cover Part B. That 20% that you got to pay is covered by the Medigap plan. You will still have a $240 deductible. Another very popular Medigap plan is Plan N as in Nancy. That plan has some low co-pays for out-of-pocket for your office visits. It does have like a $20 copay. It may have a $50 emergency room, a $240 annual deductible, and that's it. The nice thing about a Medigap plan is there's no network, so you can go to any doctor, any hospital, anywhere. You don't have to worry about choosing a doctor or hospital. The other thing that a Medigap does not have is does not have dental, vision, hearing, or prescription, so you're going to need to purchase those independently if you so desire. I always encourage everybody to buy a drug card so you don't incur a penalty. So that's a Medigap. It's going to give you, by the way, a Medigap plan also has a monthly premium. So those premiums do tend to go up each year. But that's one way to cover those numbers that are left out there for original Medicare. The other way to cover those are what's known as the Advantage plans. Very popular plans now. They're most similar to your employer plan. It's like the old commercial back in the old days with Oldsmobile. It's not your father's Oldsmobile anymore. Mm-hmm. Well, it's not the old Advantage plans anymore. They are new and much better than they were. An Advantage plan is typically going to give you a zero premium, so all of the benefits you're going to get at no monthly premium. It does have a network, which means doctors and hospitals and facilities must be in network. It gives you dental, vision, hearing, and prescription at no additional cost. And a lot of these plans give you some bells and whistles. For example, over-the-counter items. These are items you're currently paying for. This would be like your Band-Aids, your vitamins, blood pressure cuff, a thermometer, all kinds of things, toothbrush, toothpaste. You could get all of those things usually at no cost at a certain dollar amount per quarter. The other thing it's going to do is some of these plans actually have a spending card for healthy groceries and or utilities. So there are bells and whistles with the Advantage plans. But you need to be aware of the fact that it is managed care, so you do have to make sure that your doctors and hospitals are in network, which, depending on where you're at, that's what I do here, is I help you navigate through this. We put your prescriptions in, we put your doctors, your hospitals, make sure they're on the network, and we move on through there. So, there's a couple of options for you. One of the things that I do here at AMA is we make sure that whatever plan is best going to fit your needs is what we put you in. The biggest thing to understand in the difference is it's a concept difference. The Medigap plan, you're paying a monthly premium, whether you use it or not. With an Advantage plan, you're only paying for services that you utilize and use. So those are the options that most people are going to come across. With the annual enrollment period, now is the time to review your plan. One of the things that I do is I can sit down, I can do a free analysis of what you currently have. We can look and see what's new and exciting with these other plans and make sure that whatever plan we decide to go with is best going to fit your needs. And then one more thing that I'll add, and then I'll wrap up this segment here, but the one other thing that's drastically different in 2025 is the Inflation Reduction Act. It directly impacts your prescription drug plans. Whether you're on a supplement with a drug card or whether you're on an Advantage plan with your prescription plan attached, it's drastically impacted. What happens in 25, the donut hole and the catastrophic go away. You are capped at $2,000 annually for all of your medications. So the big thing that you need to make sure that you're aware of is your formulary drugs. Each company is making changes to their formulary list because of the cost that these companies are going to pay out of their pocket. If you're on a prescription drug plan, you're most likely going to see some significant increases in the premiums because these companies and the prescription drug manufacturers are not going to lose money, and they're going to pass some of that cost on to you. So I know I could go on and on and on, but these are the options that everybody has. The annual enrollment period is when you can actually review your plan, and if your plan has made some changes that are not favorable to you, we can go through and make sure that we get you a plan that's going to work best for you.
And again, that plan begins on October 15th, runs through December 7th. More than any other year, there's definitely a need to go ahead and pay attention to that because, as Scott said, with the Inflation Reduction Act and the plans that are going into effect, could be some pretty significant changes. If you have a lot of expensive medications, this could be working in your favor. If you don't take that many, this could be working in your detriment. So making sure that you understand the ins and outs and you're not stuck with some sticker shock come January 1st is as simple as reaching out to Scott and the team at America's Medicare Associates. You can give a call to the number 419-794-3030. You can find out more about the upcoming Medicare events and reach out as well at arhq.com. Click on the events tab. They'd love to have you out there.